Your questions cover a range of health topics, from cancer risk factors to digestive health and symptoms. Here are the answers. 1. Factors that cause uterine cancer in young people. While uterine, endometrial cancer is most common in older women, the risk factors that apply to younger individuals are often related to hormonal balance and genetics. Key factors associated with increased risk in young women include obesity, high body mass index, BMI. Fat tissue produces estrogen, and higher levels of estrogen without sufficient progesterone to balance it can stimulate the growth of the uterine lining, endometrium, increasing cancer risk. Polycystic ovary syndrome, PCOS. This hormonal disorder leads to infrequent or absent ovulation, resulting in prolonged exposure to unopposed estrogen and a higher risk of endometrial overgrowth, hyperplasia, and cancer. Family history and genetic syndromes. A strong family history of uterine or colon cancer, particularly a condition called Lynch syndrome, hereditary non-polyposis colorectal cancer or HNPCC, significantly increases the risk at a younger age. Early menarche and late menopause. Starting periods early or going through menopause late increases the lifetime exposure of the endometrium to estrogen. Never having been pregnant, nulliparity. Pregnancy is protective because it involves periods of high progesterone, which balances estrogen's effects. Diabetes. Studies have shown a positive association between diabetes and endometrial cancer risk. 2. Foods that damage the pancreas and their negative impacts. Foods that force the pancreas to work excessively or increase inflammation are detrimental, especially in individuals prone to or recovering from pancreatitis. Food category. Examples. Negative impacts. High-fat foods, fried foods, fatty cuts of meat, full-fat dairy, oily sauces, pastries, chips, butter, margarine. The pancreas produces enzymes to digest fat. A high-fat diet causes the pancreas to work overtime, leading to overstimulation, inflammation, and potential autodigestion, which can trigger or worsen acute or chronic pancreatitis, inflammation of the pancreas. Alcohol, beer, wine, liquor, and mixed drinks. Alcohol is one of the leading causes of chronic pancreatitis. It damages pancreatic cells, impairs bile duct function, and alters the composition of pancreatic secretions, leading to blockage and inflammation. Refined carbohydrates/sugary foods. White bread, sugary cereals, candy, cakes, sodas, and sweetened drinks. These foods cause a rapid spike in blood sugar, forcing the pancreas to release large amounts of insulin. Over time, this stress can exhaust the insulin-producing cells and contribute to diabetes and chronic pancreatic stress. 3. Foods that damage heart health. A diet that damages heart health is typically high in substances that contribute to atherosclerosis, plaque buildup in arteries, high blood pressure, hypertension, and high cholesterol. Foods high in saturated and trans fats. Saturated fats, fatty cuts of red meat, beef, lamb, pork, bacon, sausage, full-fat dairy, butter, cream, whole milk, full-fat cheese. These raise LDL bad cholesterol, which contributes to arterial plaque. Trans fats, found in some fried foods, baked goods, cookies, cakes, pastries, and certain packaged snacks. They not only raise LDL cholesterol, but also lower HDL good cholesterol, making them particularly damaging. Foods high in sodium, salt, canned soups, frozen dinners, processed meats, deli meats, hot dogs, and many ultra-processed snacks. High sodium intake leads to high blood pressure, which forces the heart to work harder and damages artery walls over time. Foods high in added sugars and refined carbohydrates. Sodas, energy drinks, sweetened coffees, candy, pastries, and white bread/rice. Excess added sugar intake is linked to higher risk of obesity, inflammation, high blood pressure, and high blood triglycerides, all factors that contribute to heart disease. 4. How long does it take for a gallbladder infection to heal? A gallbladder infection, typically called acute cholecystitis, requires prompt medical treatment, and the healing time depends on the severity and treatment approach. 1. Initial attack and non-surgical treatment, antibiotics. An acute attack of cholecystitis usually lasts 2 to 3 days with hospital treatment. Initial treatment involves fasting, IV fluids, pain medication, and antibiotics to fight the infection. If the infection is mild and the patient responds well, the symptoms can resolve. The course of antibiotics often lasts up to a week. 2. Surgical removal, cholecystectomy. The standard long-term treatment is to remove the gallbladder, a procedure called a cholecystectomy as the infection often recurs. Laparoscopic surgery, keyhole. Most people who undergo this procedure are able to go home the same day or the next. Full recovery typically takes about 1 week for most people, though strenuous activity should be avoided for a few weeks. Open surgery. This is less common and usually requires a longer hospital stay and a recovery time of several weeks. In summary, the acute symptoms typically subside within a few days of hospital treatment, but if the gallbladder is not removed, there is a risk of recurrence or chronic inflammation. Complete recovery after laparoscopic surgery usually takes about 1 week. 5. The difference between a dry cough and a phlegmy cough. The main difference between a dry cough and a phlegmy, or chesty/wet cough, is the production of mucus. Feature. Dry cough. Phlegmy/chesty cough. Mucus production. Unproductive. No mucus or phlegm is brought up. Productive. Brings up mucus, phlegm, or sputum. Sound/feeling. Hacking. Tickly. Irritating. Often felt in the throat. Sounds wet or chesty due to the movement of mucus in the airways. Primary cause. Irritation or inflammation in the upper airways, throat, and upper respiratory tract. Buildup of mucus in the lower airways and lungs. Common conditions. Common cold. Early stages. Flu. Allergies, irritants, dust, smoke, asthma, laryngitis, gastroesophageal reflux disease, GERD. Common cold. Later stages. Flu, bronchitis, pneumonia, chronic obstructive pulmonary disease, COPD. Purpose. A reflex to clear irritants or inflammation. A biological mechanism to clear excess mucus and trapped foreign particles from the lungs and airways.